we are looking for more than 170 healthcare fugitives who are charged with defrauding Medicare and Medicaid out of more than $400 million. And I'm sending a clear message to them all. We will take whatever measures necessary to track down and apprehend these criminals who steal from our healthcare programs.
In May of this year, the Department of Justice brought charges against 107 individuals who bilked Medicare for over $452 million. Just 7 individuals in Louisiana were responsible for over $225 million of this fraud. In a separate case in February, a single Dallas doctor was arrested for making $350 million in false claims. In February of 2011, 114 individuals who had bilked over $240 million were arrested in another crackdown.
When Sheriff John Brown come for you.
The Department of Justice estimates the fraud problem to be about $60 billion a year. Congressman Neal mentioned the figure of $50 billion a year. You indicated you don't have a clear estimate of what that is. But let's assume it's $50 billion a year. Take that times 10, that's $500 billion over a 10-year budgeting window. And in your testimony, you indicate here that you have some initiatives going on within HHS that by conservative estimate would save $11.3 billion in Medicare and Medicaid savings, as well as another $3.6 billion over 10 years through this comprehensive fraud fighting effort. So that's $15 billion over 10 years compared to a $500 billion problem. So why isn't there, and I think that's about 3% actually, so why isn't there more being done to really root out fraud? You said if we knew where it is, we'd go after it. We do know it's phantom billing. We know it's the criminal use of physicians' UPIN numbers. We know it's stealing beneficiary identifications for use, for criminal use. We know how it's occurring, so why are you only proposing only 3 percentage point reduction in fraud over 10 years?
Yeah. Bad boys, what you gonna do? What you gonna do when they come for you?
Or shifting emphasis, that we want to move away from the historical way of trying to deal with fraud by chasing after people after they had committed their fraud and after they had received payments. We want to move from that to a posture where we are in a position to prevent fraud from happening in the first place.
Bad boys, what you gonna do? What you gonna do when they come for you? When you were 8 and you had bad traits, you go to school and learn the golden rule. So why are you acting like a bloody fool? If you get hot, then you must get cool. Bad boys, bad boys.